Hello, my name is Phoebe Kim, and today I have the pleasure of being able to discuss the pink tax and economic barriers that prevent women from accessing hygiene products. My background can help explain my passion for this topic. I'm a rising senior at Northern Valley Regional High School at Demorest in New Jersey, and I have a passion for reforming public policy to resolve pressing social issues. How did this passion arise? While working as a grassroots activism intern for Korean American Civic Empowerment, I learned to represent the underrepresented. I also found purpose in employing problem-solving skills to affect pertinent crises affecting our community, now serving as the vice president of UN and judge captain of the varsity debate team. I pursued my passions for resolving problems I saw affecting our community. I self-published a children's book to represent Asian American experiences and Korean culture in diversified children's literature. To increase opportunities for youth to chase their passions for STEM, I coach the National Math Counts and Science Olympiad competitions for middle schoolers. Due to my passions in tackling economic gender disparities, I researched the pink tax for 2 years through my AP seminar and research classes, and this is what I have the pleasure of being able to talk about today. But you may be wondering, what is the pink tax? The pink tax is a term that refers to both the sales tax subjected to period products and the extra costs women pay as products and services. Most prominently, hygiene products like razors targeted for a female audience are often marked more expensive than products and services of the same quality and function targeted for a male audience. Is this a global health crisis? Let me simplify this for you term by term. Let's start with global. I'd love for you to look at this map. Do you see all the red? Those are all the countries where some form of sales tax may be subject to period products within their respective areas. In America, tax period products are referred to as luxury items. Oh, the problem with both forms of the pink tax is that they prevent women from accessing necessary hygiene products. Do women need more barriers that may prevent them from staying hygienic, which is the first step towards preventing our society from being affected by gastroinfectious diseases such as COVID-19 and the flu? And are period products truly luxury? When women cannot afford period products, their DIY alternatives make them susceptible to vaginal and urinary tract infections, severe reproductive health conditions, and toxic shock syndrome. Do you see the crisis? I again ask, do women need more barriers? To contextualize the problem, a survey of 2,000 women found that 49% have a lack of access to sanitary products, menstrual hygiene education, alongside other products and services that help women maintain their hygiene. The bottom line is that everyone needs hygiene. No woman should have to pay a tax because of their gender that threatens their accessibility to essential hygiene. Today, I'll elaborate in more detail about this crisis relevant to our global community, its demonstrated consequences, and courses of action that will help women have the human right to hygiene. According to the World Bank, as many as 500 million women across the globe lack access to basic menstrual products and hygiene bathroom facilities. But what is the true struggle that these women experience? I ask you to take a look at the map from earlier. Next to the map is another map. The countries marked in blue are the countries the UN recognizes as the least developed in our world. Let's look at Congo, which is highlighted on both maps. The average annual income for a citizen in Congo is equal to 449 USD. When you factor in the value-added tax rate Congo applies equivalent to 18.9%, the lifetime cost of tampons is 2,108.49 USD for a Congo woman. Considering that a woman experiences their period for 40 years, a woman in Congo must spend more than 10% of their annual salary on their period. The tax rate on period products makes Congo women subject to paying an extra 8.38 USD per year. In 2022, nearly 62% of Congolese lived on less than 2.15 USD a day. The yearly cost of the tax on period products in Congo alone is worth 4 days of labor. The pink tax poses problems within developed countries too. 2/3 of the 16.9 million low-income women in the US could not afford menstrual products in 2022, and half of them had to choose between menstrual products and food. These women are also subject to paying more due to their gender. In 2020, California women paid an average of around 2,381 USD more for the same goods and services than men per year, surmounting to 188,000 USD in paying tax within a woman's lifetime. I was curious to see whether women in my community were susceptible to purchasing hygiene products subject to the pink tax, as if they were not, then they could avoid the discriminant payment. I conducted an experiment on female adolescents residing in Bergen County, New Jersey, and one aspect I investigated was whether they are susceptible to purchasing hygiene products subject to the pink tax. I found companies that marketed 2 models of a type of hygiene product, with each targeted for a different gender, with the female version being more expensive. This distinction was made if one model was labeled for men or women, or if both products were labeled as such. These versions composed of a product pair. To develop my stimulus, I simplified the designs of real products. Through random assignment, participants received either a stimulus with 10 women's stimuli or 10 men's stimuli. Participants indicated their likelihood of considering purchasing each stimulus if found a score on a Likert scale of 1 would not consider purchasing at all to 10 would highly consider purchasing. Employing descriptive statistics, I found that for 8 of 10 product pairs, female adolescents are more susceptible to purchasing the more expensive women's products by an average of 1.142 points on a 10-point scale. I found that my participants were inclined to purchase the products marketed for a female audience, expressing susceptibility to the pink tax on hygiene products, making me realize on a new level the realness of this crisis. So what are the repercussions of a lack of access to menstrual hygiene and hygiene holistically? Urinary tract infections, bacterial vaginosis, detrimental reproductive health conditions, and toxic shock syndrome could develop when women use unhygienic practices, which are unfortunately employed as period products are made less susceptible through practices such as the pink tax. Maintaining hygiene is also key for preventing gastroinfectious diseases such as COVID-19 and the flu. Furthermore, period poverty negatively affects mental health, as women who suffer from period poverty are more likely to report moderate to severe depression. Also, Brewer and Griffin proposed a theory that consumers could be motivated to purchase gender-differentiating products to feel more physically attractive, meaning that having to purchase male hygiene products like deodorant due to financial reasons alone may pose psychological problems associated with self-identity. What can we do? The most direct solution would be to ban both pink taxes. Nullifying the sales tax on period products, which has been enforced in countries such as Kenya, Canada, and Colombia, will get rid of one financial barrier that is subjecting 500 million women to period poverty. Furthermore, banning the practice of corporations from assigning different prices for products marketed to different genders would ensure that women do not have to pay more to access hygiene products. Such legislation has been introduced by Liberal Democrat Christine Jardine to the UK and enacted in states such as California and New York quite recently in the United States. In South Korea in 2018, a boycott of spending was mobilized by women to raise awareness about gender discrimination and the pink tax subject on goods and services, including hygiene products. Helping these movements gain momentum will shed light on the importance of recognizing and resolving economic inequalities between gender that pose a threat on women's health. In summary, the pink tax is an economic barrier that prevents women from accessing period and other hygiene products solely due to gender. As both forms of the pink tax pose tangible, inherent crises, it is necessary to work towards nullifying them, as our society must not dictate that a period product or the right to hygiene is a luxury. These are my references. And I would like to thank the Global Health Leaders Conference at Johns Hopkins University for providing me an opportunity to shed light on this important topic. I would also like to thank the peers and teacher I collaborated with in AP Seminar to research period poverty alongside my AP research teacher who helped me all throughout the experimental process. Thank you to my family and friends for also encouraging me to chase my passions. Finally, thank you all for listening. Your attention and time are precious, and it's an honor to speak in front of you. If you have any questions, feel free to contact me. Thank you again.